Last month I treated a lady whose varicose veins had deteriorated over the years to the point where her leg ulcerated. Why couldn't she get NHS treatment? Most of us understand that the NHS is short of money and that not all treatments can be offered. No one, for example, would suggest that the NHS should remove tattoos or offer liposuction unless there are exceptional circumstances. So why is it that most people can't get NHS treatment for their veins? Well, it is true that most people, even with quite severe varicose veins, do not go on to develop a serious complication, such as leg ulceration. So it is right that in these times of austerity that some form of rationing is applied. However, there is evidence that general practitioners are not referring people equitably in different parts of the country, and that even people with complications are not being referred for treatment. For example, a study from the Leeds Vascular Institute and Medical School looked at primary care trust commissioning of varicose vein intervention in 108 PCTs between 2008 and 2011. They found that 97% restricted access. That means rationing. The study also found that the qualifying criteria around the country varied. That means it wasn't fair rationing. They suggested that a national decision should be made about which varicose vein patients should be offered funding for treatment on the National Health Service. Well, there is already clear guidance from national bodies such as NICE and the Venous Forum of the Royal Society of Medicine. Despite this, a study last year from Professor Alan Davis and his team in London confirms that only 62% of GPs would refer patients with skin changes such as varicose eczema, even though these skin signs indicate that a leg ulcer might develop soon. That's just over half of people with this early warning sign would be referred to a specialist. I think the current system of rationing is haphazard and that everyone with varicose eczema or leg ulcers should be referred to a specialist on the National Health Service, and the current situation of irrational rationing should be stopped. I hope you found this interesting. Please don't forget to subscribe, and that way you'll be amongst the first to see my next video. My name is Dr. Haroon Gadraj. Thank you for watching.